Welcome to AI TV News. Today, we're unpacking a major clash between 20 states and the federal government over the privacy of Medicaid records and what that means for immigration enforcement and public health. First, the timeline. In June 2025, the United States Department of Health and Human Services, under Secretary Robert F. Kennedy Jr., quietly transferred a large trove of Medicaid data to the Department of Homeland Security. Inside were names, addresses, social security numbers, immigration status, and even medical details from millions of people enrolled in state-funded Medicaid programs in California, Illinois, Washington State, and Washington, D.C. These programs use state dollars to cover certain low-income immigrants who are excluded from the federally financed system. Word of the transfer spread quickly. California Attorney General Rob Bonta, joined by officials from 19 other states, filed suit in federal court. They're asking a judge to do three things: stop any future transfers, block DHS from accessing or acting on the information already received, and order that every copy of the data be destroyed. Why are the states so alarmed? They point to HIPAA, the Health Insurance Portability and Accountability Act, which for decades has set strict limits on who can see a patient's medical file and why. The law allows data sharing to administer Medicaid, the argument goes, but immigration enforcement is a completely different mission. By handing over the files, a lawsuit claims, the federal government breached both the letter and the spirit of the privacy rules that people rely on when they sign up for health coverage. The Trump administration counters that it is simply protecting taxpayer dollars. An HHS spokesperson says the department has full legal authority to verify that Medicaid benefits go only to those who are eligible, and that cooperating with Homeland Security is part of that verification process. The administration has taken similar steps before, seeking access to IRS records and food assistance rolls to locate undocumented immigrants. Beyond the courtroom, healthcare providers are sounding the alarm about a potential chewing effect. Advocates fear that if immigrants, regardless of documentation status, believe a doctor's visit could put them on the radar of immigration and customs enforcement, they will stay away from clinics until a condition becomes life-threatening. That hurts the individual patient, drives up costs, and shifts the burden onto already crowded emergency rooms and community health centers that are legally required to treat everyone. Critics also worry about precedent. If medical records can be repurposed for immigration raids, what stops future administrations from using them for other unrelated investigations? They say the move weaponizes the healthcare system and undermines decades of work aimed at convincing vulnerable communities that it is safe to seek care. Political pressure is rising. Dozens of Democratic members of Congress have written to HHS and DHS demanding an immediate halt to the practice and the destruction of any shared data. Meanwhile, immigration hardline supporters applaud the move, arguing that the government has a responsibility to root out fraud and enforce the law. For now, the case sits before the federal courts. A ruling in favor of the states could reinforce strict boundaries around patient privacy. A decision backing the administration could open the door to wider data sharing across agencies. At stake is more than a single dataset. It's the basic question of whether medical information, once given in trust, can be used for purposes far removed from healthcare. The answer will shape the lives of millions of patients, influence the behavior of hospitals and clinics, and set the ground rules for how personal data is handled in the future. We'll continue to follow the lawsuit and its implications. For AI TV News, thanks for watching.